My name is Barry Schapiro. I am an orthopedic surgeon and I practice here in South and Central Florida. My dad was a teacher, my mom was a dental hygienist. No physicians in my immediate family. It was my cousin. I have a cousin who's a trauma surgeon. He is 8 years older than me. In fact, when I was on the trauma service as a third-year med student, he was the trauma fellow. So this is my cousin and he was teaching me. We were operating together and that was a whole lot of fun for me. We talked a lot. We scrubbed a lot. We did a lot of surgery together, and that was, for me, that was an honor. It was quite a thrill. So here's my big cousin that when I was a kid, I was little, and now he's paying attention to me, and we're doing stuff together. It was cool. I was taught that you have one chance to get it right. If someone entrusts their surgery to you, you take them to the OR, and you accept nothing less than perfect. I'm meticulous. I do everything the same way every single time. I follow the steps, I do it by the book, and people have good outcomes when you do it that way. My philosophy is such that I will attempt non-operative treatment first, and I'll make every effort not to go to surgery. But when you do have to go to surgery, then you get it right. You have one chance to do it. Probably about 70 to 80% of my surgeries are arthroscopies. Minimally invasive joint surgeries where we make small incisions and we put cameras inside the joints. I do it in the hip, in the knee, and the shoulder primarily. The majority of my patients have very good outcomes, and that's a good thing, and I enjoy watching them get back to doing the things that they enjoy doing. But my favorite group of patients, honestly, is the joint replacements. So joint replacement patients are miserable and chronic, constant daily pain when they come in, and when they leave and say goodbye to me after a few months of treatment and therapy after surgery. They're walking painlessly, they're dancing, they're going on vacation and enjoying themselves and walking long distances and back to exercising, and that's very rewarding. When I see a patient and I evaluate them for a condition, some conditions are obviously surgical, displaced fractures, etc., but a lot of conditions can be treated non-operatively. So I start with the least invasive and the least risky approach, and if there's a chance that someone can improve with a physical therapy and some injections or medications, then that's what we would do initially. And we reserve surgery as somewhat of a last resort. You know, it's a passion. I do this and I enjoy it. I enjoy having people put their trust in me, and I enjoy watching them get better. That's my favorite part about this.